Hello, everyone, and welcome to the June 2019 HHQI Preventative Cardiovascular Learning Action Network, or what we call the Cardio-LAN. This is our quarterly event, and we would like to thank all of you for taking the time out of your schedule to join us today. Before we get started, we have a few housekeeping items to review. First, today's session, like all previous Cardio-LAN events, is recorded, and it will be archived in the HHQI website under the Cardiovascular Health tab on the blue toolbar. Now, for those of you that may have accidentally stumbled into this group, or maybe you were referred by a colleague or shared link or flyer, I just want to let everyone know, first of all, we welcome you. But secondly, everything we're going to mention on today's webinar is located on the HHQI website, which you'll find under www.homehealthquality.org. Now, all phone lines are currently muted if you are listening through your phone or through your speaker, and that's going to remain so throughout the duration of today's event. But we encourage you to use the Q&A and chat feature on the right side of your screen. Now, if you're not seeing those, you can look for a bubble icon on your screen that has that speaking bubble and click that, and that'll activate your chat feature. I'd like to encourage each of you to take a minute now to locate this, as we plan a lot of chat interaction with today's session. This is our celebration and a fun time, and we want to hear from you and make this as interactive as we possibly can. So you've taken the time to join us. We hope that you'll take a few more minutes to engage with each other as well as with us, the whole improvement community. So today, as we've talked about, we are celebrating the accomplishments that we as a community, as a network, what we have achieved in the Home Health Cardiovascular Initiative. So we're going to start with a little bit of a short walk down memory lane so that we can talk about how we actually got to this point. First of all, the piloting of the HHCDR, the Home Health Cardiovascular Data Registry, was concluded 5 years ago. Once we saw that that mode of data collection was feasible in the home health setting, that's when we kicked off the Cardiovascular Initiative and kind of kicked it into high gear. The first Cardio-LAN was kicked off in November of 2014, and as they say, the rest is history. Through the hard work of everyone either participating live or watching through the archive recording, today's gathering is really a sign of what we have done as cardiovascular care in the home health setting, and the improvement through ensuring our patients are adhering to their aspirin as appropriate, blood pressure control, cholesterol management, cardiac rehab referrals, and smoking cessation. We thank each and every one of you for the efforts, whether you are in direct patient care or whether you are working with those and supporting those who are in direct patient care. Now, we can't talk about quality improvement without really first talking with a little bit of stats. So let's start with the Cardio-LAN. This is you guys. Cardio-LAN is comprised of 4,500 individuals representing 2,455 home health agencies. When we're looking at the HHCDR, now these numbers hang tight because it gets kind of interesting. 2,268 home health agencies have closed at least 1 month of data in the HHCDR, and that equates to about 7,800 episodes have been entered. Now, of those 7,800 episodes, those of you who enter data into the registry, you're already aware that some episodes have more than one topic focus. Total number of topic entries, 131,834. That means we're almost at 132 topic areas of patient data in the HHCDR. That's phenomenal. We also want to thank not only those of you that are focusing on cardiovascular and collecting your data to demonstrate your improvements. We also want to thank those of you who have provided feedback on the annual HHCDR feedback forms. Through that, we have learned of it's really non-quantifiable, some of the quality improvement efforts you all are making. But we've seen certain trends coming through that, and just like to point these out because these are things that may not be measurable, but are necessary in order to get those measures to move. Some of you have talked about you've changed your intake practices to make sure that you are capturing the most current lipid profiles. Some of you have talked about how you've integrated communication strategies and you've talked with the upstream prescribing providers to ensure that whatever their plan of care is for this patient's cardiovascular health, whether it's aspirin or statins, you're making sure that the patient is adhering to it. And you've put a lot of different efforts in place to make sure that that's working. We've also learned from many of you how you have started reaching out to your local cardiac rehab facilities, and you're collaborating and trying to make the patient the center of both of your plans of care. This is strong work. This is not something that is taken lightly, and no, it may not be measurable at this level, but we want you to know that we hear it, we see it, and we really appreciate everything that you're doing. And then we did see a trend, and this is pretty moving. Those of you that have shared your successes with clinicians, of your clinicians who have either guided patients through reducing, and even a few cases, total cessation of tobacco use during a single episode of care. That is monumental. And not only is it amazing for those of us that are watching and trying to support you as you do this, but it's also life-changing for those patients. So today we celebrate you, your clinicians, your patients, and of course, their caregivers. Now, we can't go through a celebration without talking about the most. So let's start some of these most. We have, first of all, the most downloaded patient cardiovascular health resource. None of us are surprised that it's going to be a zone tool, but what was surprising is that this is a zone tool on heart disease management. This download took over what used to be the previously most downloaded, which was the heart failure zone tool. So, okay, I'm just making inferences here, but this tells us that not only are you expanding your cardiovascular plans of care and your quality improvement beyond heart failure, now including heart disease management. So we'd like to thank you, all of you, for doing that. That's very impressive. Most downloaded clinician resource of the cardiovascular health resource. Now this one was a little bit of a surprise to us. The winner of the cardiovascular health was the cardiovascular health PIP example, the one on the left. That example was the most downloaded, and honorable mention goes to the tool on the right, which is the cardiovascular health PIP tool, as well as those at the bottom that you can see, the OARS model, which is going to be showcased a little later in the session, and always the popular how to actively engage patients to change behavior. All of these are linked at the bottom of the screen so that you can download those if you haven't seen them or aren't using them already. While celebrating the spread of cardiovascular quality improvement, you know, we must recognize one of the easiest ways for each of our clinicians to gain current evidence knowledge while earning CEs is through the HHQI University courses. Currently, the university has 20 courses focusing on cardiovascular health, and these courses range from 1 to 2.5 hours in length. Now, including the AID course, there's currently 20 courses that have been taken for a combined total. I know I'm probably boring some of you with these stats, but they overwhelm us, so we wanted to share. A combined total of 3,600 times, equating to almost 5,400 CEs awarded. The most popular, I've just jumped ahead on the slides, but I'll just mention the most popular cardiovascular course was the exercise prescription for the home health patient with heart failure. And probably not coincidentally, that was also the best attended cardio LAN of the past 5 years with over 1,500 live attendees. So most of you probably attended that or have watched it since then, but we want to thank you if you have, and I hope that you did learn from those presenters. They were fantastic. Now, honorable mention for the most popular cardiovascular course goes to the cardiovascular health for at-risk populations. As part of our celebration today, we would like to recognize today's frontline experts, as you see on the screen. Our experts today come to us from Phoenix Home Care from Burr Ridge, Illinois. We were introduced to the success of this agency through their work with Kristen Moreno and Fran Odie with Telegen, the QIO, the Quality Innovation Network Quality Improvement Organization for the states of Illinois, Colorado, and Iowa. Now, we're pleased the leaders of Phoenix Home Care accepted our invitation to join us today and share a few of their resources, their implementation strategies that they've found successful. So please allow me to introduce you. Pete Miska is the owner and administrator of Phoenix Home Care. He is a 30-year veteran in post-acute care continuum. This includes home health, medical, infusion, and hospice industry. Lori Creamer, RN COSC, came to Home Health Arena in 2013 after working for 18 years in an acute care magnet hospital. In addition to her nursing experience, She also brought the priority of quality care. She has been with Phoenix Home Health for the past 4 years, serving as the agency supervisor, and as Pete refers to her, as the agency's quality guru. Phoenix Home Care is an IDPH deficiency-free, Joint Commission accredited, 5-star CMS-rated Medicare certified home health agency that's been servicing Illinois families for over 20 years. Pete, I will turn it over to you, and the floor is yours.
Thank you very much. We appreciate you letting us come and talk to the group here. And we'd also like to extend out a thank you to Kristen. She's done a great job being out there, being a representative for the HHQI and working with all of the organizations, or a lot of the organizations in Illinois, being very visible as well as accessible. So we really appreciate that. We've been participating with the QIO, or the HHQI, since the inception of the program, and been very, very impressed in terms of how they've been able to help us sweeping that data from the EMRs that we've been able to do interoperatively with them, giving us reports afterwards as in real time as possible. So thank you very much. We were also, one thing I forgot to add is we were 1 month voted as with the Agency of the Month as well with the QIO, so we appreciate that. And then what I'm going to do is I'm going to turn this over to Lori, so you can then start talking about some of the tools and things that made us successful and that we help helping our patients that are suffering from illness and injuries in the community. So, Lori, I'll turn it over to you.
Well, thanks, Pete. You know, after having all those 18 years working in the acute care setting and working in a high-quality culture, I did experience culture shock in 2013 when I came to the home health arena to provide my skilled nursing services and experience. One thing that I couldn't find readily before I came to Phoenix Home Care is, where do I go for the best practices on disease management in this post-acute and community environment? So after I joined Phoenix Home Care in 2014, I was introduced to the HHQI website and was excited to have at the point-of-care site tools to assist not only me but the patient with getting better outcomes. We've had the ability to print the tools right there at the point-of-care site in the patient's home so that we can leave the patient with these tools to help them in self-managing their disease processing. Now, after access to the best practice interventions, or the BPIPs as the website refers to them, it gave me as a clinician instructions and tools that focused on decreasing acute care hospitalization rates for the patient in the agency. It also helped me as a clinician to teach the patients how to manage their particular disease processes so that they can once again feel independent, as well as the cardiovascular tools, as well as the medication management and the zone tools, posters, webinars. They're used daily by our clinicians here in the agency and our patients. These tools, they allow the clinician to feel good about their care, because it helps them to provide the patients with a self-care attitude. It helps them to provide and to perform the activities that's necessary to achieve and maintain and to promote optimal health by self-monitoring their symptoms and making sure that they report any symptoms that's different to the healthcare provider and to us as clinicians. So this first tool, these are the zone tools that we use, or spotlight tools, as the HHQI like to render them. They have red, yellow, and green colors, and we print these out in mass quantities and put them into the start of care books, as well as not only is the red, yellow, and the green, but also they include action steps for the patients, when to call, who to call. They're provided in many languages, which you can see that Spanish one there we use quite often with our Spanish-speaking patients. But these zone tools, they help the patients to become engaged with their goals. that's established, that we've established in the plan of care. And we help them to realize that they don't always have to go to the ER, that they can call us and we can intervene or make a triage call or make a touch point call and see where are they in that red zone, that yellow zone, or that green zone, and green is the goal. Not only do we use these particular zone tools, but if I can have the next slide, Cindy. We also know that changing in smoking and tobacco habits are probably one of the most difficult for our patients and our families to make. However, we use some of these tools listed here to engage the families and the patients with use of evidence-based health materials and information. And then you can have the opportunity to get the patient and the caregiver involved. And then we found that we are more successful. The more engaged the patient and the family is with their care, the more successful they are. Can I have the next slide, Cindy? Now, these are some of the educational videos that we use on a weekly basis. They're based on best practices that we use as several of the key strategies so that we can improve our patient engagement and our patient outcomes. We use these HHQI, like the cardiovascular health patient videos, to focus on cardiovascular health topics. As you can see from, we can use these right on our iPads. We have them right there at the point of care site. We ask, have you ever wondered how your blood pressure medications work with your heart and your blood vessels? And then we watch the video, and then we teach them their medications. So we also do that with how to take your blood pressure. We use that with the caregivers as well as the patients. And then they have something that they have tangible in their hands when we print out the different logs and information and things of that nature, so that when we do make another touch point with them, they'll be more engaged with us and they'll know exactly what we're looking for and what their doctor has ordered and what their doctor expects from them, as well as they too want to be engaged and they want to feel better. Can I have the next slide, Cindy? Now, these are two posters that we have in every SOC book. The first poster illustrates a senior's living room, and it contains 14 common dangers that can cause seniors to injure themselves at home or to fall. So this is part of our PI program, our fall prevention program. And then after we go over the poster with the patients and the caregivers, we ask the patient, now, after seeing this and being educated about this, what do you see of concern in your home as regards to safety? So we don't just go and move things around. We first educate the patient as to why this is unsafe, and then we ask for their engagement as to if they think it's unsafe, and then we go to helping them make their home safe. Sometimes the patients and caregivers, they can point out causes and concerns, and they can correct them before we even get into that question. Now, the next poster is the Call Me First poster, and that we give to our patient and caregivers to remind them to call the home health agency before going to the emergency room for non-emergent reasons. And this allows the agency to do that triage call and to intervene and call their doctor and maybe even alleviate a ER visit. Next slide, Cindy. Now, these are some tools that we use, or examples of tools that we use as handouts to give the patient at the point of care site. We usually print these out or have them already in the start of care book. We use the first tool to aid in the instruction of the disposal of needles used in the home. Safe needle disposal is part of every insulin-dependent diabetic patient's care plan, or the short-term anticoagulant patients. And so we give this handout so that they can see alternatives to using just the standard Sharps container, and when and how to dispose when the container gets full. The next slide, Cindy. Now, these are some of the tools that we use with every diabetic patient and caregiver. I even use these tools. I have it sitting on my desk, the first tool of exercise and still keep your seat. I use it while at my desk because I'm a diabetic myself. The caring for your feet and how to check your blood sugar handouts speaks 1,000 words that the clinicians do not have to speak. And they don't have to be stressed out. Did I remember? Did I lose a step? Did I tell them everything? These tools we just give to our diabetic patients. And they can be printed out right there at the point-of-care site. Next slide, Cindy. So realizing that all healthcare professionals have a role in protecting adults with chronic health conditions from the flu, we provide this poster in all of our SOC booklets, and we especially go over this poster with patients who have declined or do not want the influenza vaccine. We use this poster to educate and motivate the patients with chronic diseases such as heart diseases, respiratory diseases, or diabetes. And we educate them about the dangers of the flu and encourage them to get vaccinated. We remind them of the potential complications of the flu, such as worsening of their of their chronic condition, and how it could even trigger a heart attack or stroke. So these have been very instrumental in helping us to help the patient to not only remain with a level of independence, but to have good outcomes. So to wrap up, our agency has a desire to improve patient outcomes, and we use the HHQI's tools, their variety of evidence-based educational tools and resources to help us to improve the quality we provide to our patients. So I'll turn it back over to Cindy.
Thank you, Lori. My goodness, can you all tell why they are a five-star agency? We appreciate you taking the time to share all that with us. And I know that some of you are going to probably start to formulate questions for Lori. That's fine. Go ahead and use the Q&A box. But in the meantime, we'd like to ask all of you to take 60 seconds and start thinking about what other types of interventions that your agency has tried to use or implement to enhance patient self-management and patient engagement. What successes have you had that can share the success? So we'll take 60 seconds here and ask that you each go ahead and use the chat feature. Just make sure when you do that the to box is listed for all participants. I see a few of you are using HHQI info. Please continue to do that. That's just fine. I know that some of you listen to these webinars and are not able to actually use the webinar feature as you're on the road. So for those of you that are emailing those suggestions to us, thank you for that. All right, you can go ahead and keep them coming in, but we're going to go ahead and move forward. We do appreciate a lot of the suggestions that you have because it is something that we're able to share with others as well. In the meantime, we're going to move forward with the HHQI staff picks as favorite resources. And yes, this is most of our crew. Those who are missing are our analysts, and they are busy getting those data reports ready because all 13,000 agencies do have data reports that are due to you in the next few days, so they weren't able to join us today. But this is the majority. And to start, we're going to turn this over to Misty Kevich. Misty is an RN project coordinator who is the leader of education aspect of HHQI, and this includes the HHQI University and all of the content that's in it. Now, Misty, I'll turn it over to you for your favorite tool.
Thank you, Cindy, and thank you, Lori and Pete, for joining today. I loved the information. And Lori, my tool kind of comes right off of one of your comments about trying to motivate those patients to get their flu vaccines. So one of my favorite tools is the OARS model. And OARS is a tool that can be used with motivational interviewing, or what's known in the industry as MI. Before I talk about the tool, I'm just going to talk briefly about MI. I'm passionate about the use of MI to improve patient engagement and success in behavioral modifications. MI is really a counseling method that's used to assist patients and resolve those ambivalent feelings and insecurities that patients have and help them find their internal motivation to make change, just like Lori was talking about. MI began originally in the 80s with alcohol dependency, and then it moved into drug addiction, psychiatric conditions, and then over the last, about 20 years or so, it has really come into light for chronic disease management. So MI skill sets and tools are perfect for us to use with many of our cardiovascular health patients, since medication adherence or lifestyle modifications are part of the evidence-based practices for those specific cardiovascular diagnoses. And it does take time to learn and practice MI. But some of the tools are very simple, and you can use them without a lot of instruction. And the OARS model is one of those. I think this is a great example. So OARS is an acronym, and it stands for Open Questions or Open-Ended Questions, Affirm, Reflect, and Summarize. And you can use one or more pieces of that OARS model. So you could just use open questions, or you could use open questions and reflect. It doesn't matter. You don't have to use all of those. And what you can do is you start to learn to listen instead of talk. We tend to do monologues a lot with our patients, and we want to listen to what they have to say. Discover those underlying fears or misconceptions, provide needed education, and ensure that that patient understands that you're understanding each other and that we're on the same page about the patient's goals and the action plan. And it has to be their action plan and their goals, not mine. So with open-ended questions or open questions, it's basically asking questions so the patient has to tell you more than a yes or a no or a one-word answer. When we ask questions, we can start with how, what, tell me more about, or show me. And this requires a more detailed answer, and it allows the clinician to get a lot more information by exploring. And so we could follow up what they have to say with another open-ended question. And so that's how it works. So there's some examples. This is a simple sheet to give you some ideas of how to start. Affirm, the A, is for you to give nonverbal or verbal cues to show that the patient that you're listening and you value that communication exchange. Examples can include that eye-to-eye contact. Don't put your head in the laptop when you've asked the patient a question. Use head nodding and smiles, and really appropriately give positive comments when they have said something good. You can use phrases like, I've seen you've been working really hard by adding 5 minutes of exercise or walking every day this week. I could tell Lori, you've done really well by doing some of those exercises in your chair this week. You've been doing really well with reducing sodium in your foods this week. So things that part of the action plan, and we've had dialogue about, I can give positive feedback. Now, I want to correct something that might be wrong, but we want them to know we value what they're telling us. The reflect or reflective listening is very similar to active listening that we pretty much all know, but it does go a little further. This is where we want to summarize in our words what the patient has said. But we want to go a little bit further by making a guess. We can either connect a couple pieces of information or extend what they have said to see if we can gather more insight. And this lets the patient really hear what they have said to us and have that opportunity to correct what was said or confirm it. And then summarize, and this can be used when you're switching topics or wrapping up your visit. So you could review key points, action plans for the next few days or for for a week. And you can always end your visit by asking, are there any other questions or is there anything else that I can provide you or help you with before I go today? So that's a good way to summarize and making sure that we're including it is very patient-centric. So I think the OARS model tool is this is just a very simple one. It gives you some basics to get started. If you're interested in learning more, you can go into our HHQI University. There's a Basics for Chronic Disease Management course that talks a little bit about OARS model, as well as our patient self-management course as well. So Cindy, I'm going to turn it back to you.
Thanks, Misty, and I hope that everybody had a chance to look at that tool, at least know that it's available and you can get additional information, especially if you're having difficulties with patients adhering to the regime that you and your clinicians are laying out before them. So next we're going to turn this over to Andrea L.L.C. Now, Andrea is the person who is behind HHQI, who keeps all of the elements of internal quality tracking and reporting moving along. And some of you may have communicated with Andrea through HHQI info. So Andrea, I'll turn it over to you.
Thank you, Cindy. Can you hear me?
Sure can. You sound great.
All right. Good. Thanks. I actually have two favorite tools that I personally use. The first tool is the My Blood Pressure Log. I was attending a women's health fair several years ago, and my blood pressure was high, and I was actually there with Cindy. Probably the worst place that you could be with your blood pressure to be high with a nurse. Cindy was very determined that I was going to go to the Med Express right then and there. I reassured her that I would call my doctor on Monday. I called my family doctor on that Monday morning, and he confirmed that my blood pressure was high and I would probably need to be placed on medication. Before putting me on medication, he asked me to keep track of my blood pressure every morning and evening for a week. I went straight to our website, printed off the log. It was definitely a helpful resource for my doctor to use in choosing the best course of action for getting my blood pressure under control. So thank you, Cindy. My second favorite tool is the My Medication Pocket Card. I recently moved 2 hours away and had to establish all new doctors. I printed off the card, filled it out. I took it to every new doctor appointment that I had scheduled. Each doctor would comment on how nice it was to have all the medications and dosages in an organized manner. I keep the card in my wallet in case there would be an emergency, and then my information would be easily available. So thank you, Cindy, for letting me share my two favorite tools.
You are welcome. And in my defense, anybody that is out there that is a nurse, you understand that if she went in for the first time for blood pressure and was put directly on medication, we weren't talking about a 140/82 blood pressure, okay?
It was bad. It was bad.
Yes, but now you're going to get it to where no one's going to want to be around me at any point of a health fair at all. All right, but I agree with you. I had forgotten all about that. And I'm good. Yes, I followed up with my friend Andrea to make sure that it took care of it.
She did.
The medication pocket card is a really... All right, now we're time for another chat question. Now, a lot of you have put your chat into the Q&A box. That's just fine. We're interested in hearing anything that you have to say, and if you're using the Q&A box, you're not going to see the all participant option. You might want to look for the chat feature, but it's okay. I will just summarize for those of you that, because the Q&A only comes to those of us at HHQI, and I will tell you that we've learned that some of you, in regards to the previous question, have created caregiver toolkits. Really would like to know about that, because a caregiver toolkit is something that's a little different than a patient toolkit, and that you've included many of the resources from HHQI. That's a really great idea. We see that others of you have also used the Call Me First poster. I think that we've heard quite a few options on the Call Me First poster, so good job, guys. The next thing we're interested to know, and again, you can do it in chat, the HHQI info or the Q&A, is what implementation tips do you have to share with someone who is new to quality improvement or new to HHQI? Maybe this is a lesson learned, or maybe this is a tip that someone told you when you first started. So let's just take 60 seconds and see where we stand with that. All right, I can see a lot of you are struggling with the chat feature, but you are blowing up the Q&As. That is perfectly fine. So thank you for that, and info is going on. So what we're seeing as far as a few of the trends, and this may come from you, or some of you may have already shared this with others, implementing no more than a few tools at a time, sticking to one disease process at a time. And it does look like quite a few of you are including some of the tools in your Start of Care package, so that's really good to know. All right, we're going to move next to Crystal. Now go ahead and keep the feedback coming in. We're very casual during this particular session. So with Crystal, Crystal Welch is an RN project coordinator who leads the Stakeholder Work Committee. Now, the Stakeholder Work Committee is one of our two key HHQI leadership groups who serves as technical experts for HHQI. Their work includes providing input on all of the HHQI resources before we put them on the website, as well as making sure that we're moving towards impactful improvement strategies, not just things that are out there for just to be out there. We really want to make an impact. Now, Crystal's on the road today, but she's agreed to pull over and share her favorite resource. So, Crystal, I'll turn it over to you.
Well, thank you so much, Cindy, and thanks for the opportunity to share my favorite HHQI tool. I'm just going to kind of start with the things that we know and kind of include me in this list because I'm guilty of this. So we know that medication has benefits, and we know also that they can cause potential problems if not used correctly, and this is true for both prescription and over-the-counter drugs. And we know that taking our medicine as prescribed is important in controlling our chronic conditions and treating our temporary conditions and basically just our overall long-term health and well-being. So why is it that I have a hard time and why do we, it makes me wonder, if I have a hard time, why can't I or why our patients are having problems taking their medication properly, and, for me, I feel like is it a question of the different times of day I need to take my medication? Is it because there are many medications? We know that the greater number of medications prescribed have a higher and the higher dosing frequency, as many times as we have to take them, the more likely we are to be forgetful or non-adherent. So for me, this one HHQI tool has been beneficial because, again, these are the things we know. The medications we take daily to manage our conditions are most effective when we take them the same time every day, which also helps us remember. So I personally have trouble keeping track of my medications, and that's where the tool, my favorite, the HHQI Patient-Friendly Medication Schedule, has been very beneficial. It's just very simple to use. It's a visual way to show my medications, including the things that we have to take on a regular basis and those that are as needed for the PRN, as we call them, drugs, because there's some medication lists that don't have are either as needed drugs or even over the counter. So if we have to take our simvastatin or furosemide or insulin, it's all in there. You can put it all in there, and I love the fact that we have pictures to use and let us know when we take our medication. So just, basically we want to prevent those drug events, and we want to make sure that our patients and ourselves, we have a direct impact on our well-being, and just the creation and implementation of this patient-friendly daily medication schedule. It can always improve the way we deliver our care and the way the care is delivered, and don't forget about the family participation, as Andrea mentioned. It's just one of those things that if somebody knows where your list is or what you have, if you've written it down, it can really be a critical component of patient and family-centered care and just being a vital part of making healthcare safer. So, again, this is my favorite tool because it just enhances the communication with patients and family members and enabling patients to better understand the medications they receive. And an additional welcome byproduct, of course, is the prevention of medication errors. So this is just a great tool, and keeping it handy on the chart to share with doctors or emergency personnel is also a great piece of documentation to have. So, Cindy, with that, I'll turn it back over to you.
Thanks, Crystal, and thanks for being safe on the road today and taking the time to join us. We appreciate that. I think all of us that have traveled and presented while on the road, we understand how difficult and challenging it is to find that right cell spot. So thank you for all the extra effort. We appreciate it. Next, we're going to turn it over to Misty Dyke. Now, Misty is the one who leads HHQI Communications, and in kind of my terms, it simply means she makes everything happen that is HHQI. She's the one that's behind the scenes making sure everything runs smoothly. That includes every single webinar, including this one, the HHQI website content, the resource library, the social media aspects, all e-newsletters, postcards, updates, and, well, basically everything. So, Misty, the floor is yours.
Thank you, Cindy. I typically don't speak on these webinars, so I've been told that my microphone's a little soft today. I'm going to try to speak up, so I apologize if it sounds like I'm yelling at everybody. But my favorite HHQI resources is actually a group of resources, and those would be our educational videos for patients. And Lori spoke to these a little bit earlier. And they're really just great tools to reinforce the information that you share with patients during your home visits, especially on those topics that really require their active and sustained participation, like smoking cessation and at-home blood pressure monitoring. And you could leave behind information in a brochure or some other kind of written literature, but we know that we all have, there are a lot of patients out there who are much more likely to watch a short video as opposed to reading a big packet of information. So, and I would be included in that group for sure. For those of us who absorb information better through audio-visual learning, these videos are great reference tools to combine with those written materials. And you can watch and discuss the videos during your visit, and then the patient can rewatch them as often as they'd like before your next visit. And each of these videos is about 5 to 8 minutes in length, and so we are not going to play the videos today, but I will show you how to find them on the HHQI website and on our YouTube channel. So I am going to switch over to a screen share here. All right, so we are now on the HHQI website, and the web address is www.homehealthquality.org. So when you're looking for the videos, and this is actually how you're going to find all of the resources that are being discussed today, you can go to the resources link here on the main navigation menu, and that's going to take you to our complete online resource library. Like I said, everything is housed here. We have over 1,000 resources. To get through those and find what you're really looking for, we provide these filters to kind of sort through and bring what you're looking for to the top. So under material type, you'll select video, and under audience, you'll select patient, and then that'll filter everything down and just show you our patient videos that are available on the website. You'll see here that there are MP4 versions that you can download to your computer. And we also have links to stream the videos on YouTube. So this link will take you directly to the specific video on YouTube. And also, to get to our YouTube channel, you can go up here to the top of the website. We have these social media links on all the pages. You can click on that YouTube icon there, and that takes you to our YouTube channel, which is HH Quality Improvement. And here you can go, let's see, we have more than 100 videos on here, and that includes the educational videos for patients. We also have educational videos for clinicians, and all of our HHQI webinar recordings are also housed here. So you can click on playlists, and then click on created playlists, and that shows you everything organized by topic. So you can see we have playlists for each of the ABCs on our YouTube channel: aspirin is appropriate, blood pressure control, cholesterol management, and smoking cessation. And then down here towards the bottom, you can see we have playlists organized by audience. So we have our clinician videos, and these are the patient videos I was speaking to earlier. click into that list. So this is a nice, convenient way to see all of our patient videos in one place. And scroll down through here and see we've got 11 videos that are available for streaming off of YouTube. And agencies that have used these videos have told us that they really help to initiate conversations and keep patients engaged. And we'd really love to know if and how you've used these videos, which I believe leads us to our next polling question.
And it does. So if you could take a minute, everybody, let us know how you are using these videos or how you plan to use the videos, because we're hearing of innovative ways across the board. So let's just go ahead and take 60 seconds. And again, if you're able to put it in the chat feature, do. If you're more comfortable with Q&A where it's private to us, that's fine too. Or if you are just listening and want to send it through HHQI info, that is fine as well. We're monitoring that and we can bring your comments forward. So let's just take a minute and let everyone know how you're using these or if you're using them. All right, we've gotten quite a few of you that are saying that you're using them on iPads or tablets. We've also heard over the times that using these through their telehealth monitors. I don't know if that's what those of you that have said tablets are meaning, but we've heard of agencies implementing the videos in the telehealth monitors so that they're able to display, and it's not taking clinician visit time to do it. It's actually showing as part of the telehealth visit. Others have talked about streaming them through waiting rooms, such as with physician offices if they're part of a hospital system. If any of you are on the line that have given those ideas, please, I'm not trying to take your ideas. I'm just wanting to share with some of the innovative ways that we've heard of the use of the videos, in addition to showing them during the visit as we've heard here today. So keep that feedback coming. We really do appreciate it. We also want to, take the opportunity to share. That's what our point is here as the cardiovascular land. What's working, what isn't, and what are some other ideas that you may not have thought of that can maybe get you thinking in a different direction. Next, we're going to hear from Shannon Wright. Shannon is the director of HHQI National Campaign. And as the director, he's the one who really lassos all of us and keeps us moving and keeps HHQI going forward. He does this by creating a collaborative and safe environment, allowing all of us the ability to think outside of the box. This is where we have this understanding that no idea is too far out there. He's been driving HHQI for the past 10 years, and today he's taken the time to share with us his favorite resource. Shannon?
Thank you, Cindy, and thank you, everyone, for being on the Cardio Land today. And, like other members of the team, I have a lot of favorite resources, but the one that really stands out to me for multiple reasons is the Fax Communication Sheet. First of all, from a practical standpoint, it's a one-stop shop document. It informs you of your up and downstream providers about your agency's focus on cardiovascular quality improvement, while also collecting required order clarification on the ABCS. This also gives your referral sources a visual collaboration of your agency and the Million Hearts Initiative by having both logos on the same page. And that's really one of the great things about so many of our HHQI tools and resources is the ability to brand it with your own logo on there so that your patients and your collaborative providers can see that you're participating in this initiative and you can help take ownership of the tool. So many of the materials we have are offered as various formats so that you can customize them for yourself. And that's one of the really great things about so much that we have to offer at HHQI, and it's really nice to see the Million Hearts initiative denoted as well. I'm sure you're all very familiar with Million Hearts and the wonderful efforts being undertaken by various government agencies to prevent 1 million heart attacks and strokes here in the United States. Beyond the practical application of the Fax Communication Sheet, I also personally like the Fax Communication Sheet because it is old school. It's fax and it works. Those of you who know me know that I'm not necessarily what you would call an early adopter of a lot of technology. I subscribe to the adage of if it ain't broke, don't fix it. And for a lot of providers, fax is the perfect way to still communicate. It's secure, it's easy, and it's inexpensive. Those of you who know me know that I like to hold on to technologies that work. I had a flip phone until several years ago, and not one of the burner flip phones, but rather holding on to one from 2005. Finally traded that one in, and now I'm using an iPhone 4S, which is also an older technology, but it works. As an aside, I have a car with a cassette deck, and yes, I listen to cassettes. So that's why, for me, the Fax Communication Sheet is one of my favorite HHQI tools. Cindy?
How am I supposed to follow that? I'm laughing too hard. Okay, one thing he didn't mention to any of you about his flip phone, there was some duct tape involved as well. So thanks, Shana, for sharing all that. We appreciate it. Now, I'm the final HHQI team member sharing today. And for those of you that I haven't met, my name is Cindy Sun, and I'm an RN project coordinator. And it's been my pleasure to lead the home health cardiovascular work, as well as the other HHQI key leadership group, the HHQI network coordinators, over the past number of years. And for those of you that aren't familiar with the network coordinators, their primary function is really to keep all of you informed of simplistic improvement, integration, strategies, and different resources that are up and coming. Now, my favorite, I have, just like everybody else, many different favorite tools. This is the most recent one that I've implemented with a family member. I have a family member who I've used many of the HHQI tools successfully, I might add, but this sodium tracking has been really almost a game changer. This is with my uncle, and many of you have heard about my uncle, and he recently was told he needed to start monitoring his sodium intake, and this is not something, as with most people, that's easily done. And so I brought this tool as well as other sodium information tools because, of course, I'm the niece. I'm nobody. He's not going to listen to me. So I brought him papers. That's what he responds to better. Now, this particular tool was recently updated thanks to Misty Dyke. And this last column on the right-hand side where it's talking about total sodium consumption, I'm mentioning this so that if you have an older version of this tool, I personally found this one to work a lot better because it's not just looking and having our patients or my uncle looking at the servings of how many servings of sodium, what a serving of sodium equates to, it's how many did he actually eat. And I got to tell you, this has really been impactful, not only in finding those hidden sources of sodium in all the foods that he's eating, but it's also, he started asking about sodium content at one of his, he goes to a local cafe and he started talking to the cook about what is the sodium content so he can fill this table out. So for personal reasons, this has become my newest favorite tool. And I did want to share with you the newness of it that has been recent. So if you have an older version, I want to encourage you to download this one and start including it with your patient teachings. So our last question is, what are your favorite resources? What have you found to be the most useful, the most helpful? And out of respect for time, we're going to go ahead and move forward, but we do want to have that information from you. And I'm going to stop now for a couple of questions that have come in, and we want to make sure that we have the time. So far, the questions are aimed towards Lori. So, Lori, if you're still with us, I'd like to ask you the first question is, have you used some type of telehealth equipment to also address cardiac health and patient engagement? And if so, what has been your experience with the telehealth situation?
Well, that is a good question. And I'd like to answer the question, but how about we take it offline? It's such a lengthy answer.
Absolutely.
And if you can leave your name with Cindy and your email, then we'll get back with you.
That would be great. So the person who asked that question, just go ahead and shoot your information to me. I'm at HHQI Info, and it'll be on the last slide, and we'll be able to take care of that. Now, Lori, another question that came is asking more specifically about the iPads and the videos. Do you stream or do you download the files on the iPads for the videos?
So we do both. We first find out where our patient is located. If we found that at times we have had a problem with the reception for the data in that area, then we'll download it to the iPad, and then we can just show them directly from the iPad. But mostly we stream it. Our iPads have unlimited data, and then we have a portable printer. So we can stream it, and then we can print any hard copies that we might need to leave with the patient.
Thank you for that. Another question has come in, and it looks like it's been answered, but I want to make sure that we address it with everyone. The question is the funding and the source of HHQI tools. Is everything free? We say it over and over, and I apologize for missing it on this one, but yes, everything in HHQI is funded by Centers for Medicare and Medicaid Services, or CMS. That means that everything is in the public domain, it is free of copyright, and it is free of charge. If there is a tool that says that it's copyrighted as you go into HHQI resources, and there's about 5 out of 1,000, but those have the word copyright on them, you're free to use them, but you're not free to edit those 5 tools, and primarily because they're validated tools. You edit the text, you lose the validity. So please feel free, use the tools, adapt them as you see best, as long as it's not one of those 5 or so that say copyright. Edit the text. If you have a tool that is, oh, this would be perfect if only it addressed this or it addressed that, edit it. Most of the tools are in Word form, and if they're not, contact us. If we can convert it to a Word form, we're happy to help you with that so that you can edit to be what's best for yours. If you see another agency logo on the tool or the resource, this tool has been vetted, and the agency has given us permission to use it. So if you find that, you can remove that agency's logo and put your own on. And you may want to give a little professional credit at the bottom from that agency that supplied it. But feel free to use the tools as you like and as you see best. So we thank you for that question, and I apologize for not mentioning that earlier. So with this, I think we are at the top of the hour. We are going to go ahead and conclude. For those of you that have continued information to provide to us in chat, we are always interested in hearing what you have to say. Please feel free to share it with us so we can share with other agencies and really make this a collaborative effort. That's our goal here at any of our Learning Action Networks, but especially in this cardiovascular prevention area. So with this, we'd like to say thank you to everyone. Please contact us if you have any questions. And for the person who did ask the question of Lori, send me your contact information and we will definitely get you in touch. Have a great summer, everyone, and thank you for taking the time today. Have a great day. Bye-bye.